Yes, so welcome this evening. My name is Margo Claybrooks. I am a mental health provider here in the state of Maryland. This evening, we will be talking to you about mental health. What is mental health and the stigma on mental health in the African American community and the Black and Brown community. And this evening, I have here with me a few of my colleagues in the field of mental health. And I'll allow for them to introduce themselves and then we'll start from there.
Thank you, Margo. My name is Shanice Martin. I am a licensed graduate professional counselor in Maryland.
Thank you, Margo. My name is Edna Che Grayson. I'm also a mental health professional, a licensed graduate professional counselor, also in Maryland.
And my name is Pierre Bachelor Doval. I'm a school counselor, and I'm currently doing my one last class so I can apply for my license so I can become a mental health counselor as well.
Well, welcome everyone, and also welcome to our viewers. And so, again, tonight's discussion is on mental health, and we're trying to spread awareness as it relates to mental health, and particularly in the African American community, and the stigma on mental health. And so, one of the questions that we often get is, what is mental health? Mental health is the social, emotional, and psychological well-being. And we all try to work hard to maintain that well-being. And it's basically trying to maintain that balance so that we are always practicing more healthier, options or coping skills to deal with some of the stresses of life. And so being able to maintain that, whether on your own or with the help of a professional mental health provider, will allow for you to live a more healthier life. That's the idea of mental health. And so the stigma that usually goes with that, with mental health in the African American communities, is that it's a sign of weakness, or others do not want to be seen as having a mental health illness. And so a lot of times you'll have families who try to work on mental health issues, by self-coping, or how you say, like coping with medications, or coping with self-medicating by alcohol and substance abuse. And so tonight we just want to kind of raise awareness to let individuals know, what is mental health. We'll talk a little bit about that, but then also some of those coping skills that we can use to help us manage a more healthier way of living and dealing with those mental health stressors that come about in life. And so I guess tonight we are going to answer a few questions, right? And one of the first questions that we will discuss tonight is some of the barriers in the African American community or urban communities where mental health, is not so accessible. And so what are some of the barriers? I want to maybe start with, that being the first question. And I guess if we want, we can start with you, Shanice.
Sure. So I would say, for one, a barrier is accessibility. Some African Americans don't even have health insurance. And so they don't have the option to pay out of pocket. And if they don't have health insurance, they're not able to pay for it. So that's one option as far as why they're not able to see a professional. Another option is as far as not really establishing good rapport with a therapist. They may go one time and not feel as though they have a good fit with them, and just feel like therapy is not for them. And so they don't actually end up going to another therapist to try them out. So, which is sad, because sometimes if you go to a doctor and you don't like them or don't like their diagnosis, you go to the next doctor for a second opinion. Mm-hmm. So it's the same thing should be done for therapy. If you don't like that therapist, go to the next therapist. So definitely some barriers some African Americans deal with as far as why they don't go to therapy or live in mental health.
Right. And go ahead, Pierre.
To kind of piggyback on what Shanice just stated, going back to healthcare being an issue of to why we are not able to gain access to mental health care. Also, social economics play a big part of that as well. where you have about 15% of Black adults in America had no form kind of health insurance. So you're talking 15%. That's a lot. And then you also have that's another thing that can be a big factor, because if you're not financially able to afford a therapist, then you can't really get the help that you need mentally. And I think that's a big factor. So just to pick it back on what Shanice was saying.
Mm-hmm. Yeah.
I would say gender. Women seek more help in comparison to male counterparts when it comes to mental health. That's just the way it's been. But I'm seeing a trend where men are becoming more accepting of seeking professional counseling. So there's been a bit of a turnaround, and we hope that it continues to turn around, because we don't internalize as much as men do. We kind of will vocalize, if even it's not to a professional at some point, is to a friend or your parent or a pastor or someone that you kind of divulge information to. But that can also be a barrier.
Right. Yeah. And so basically what I'm hearing, a lot of barriers around one kind of, piggybacking what you said, Edna, is whether it's gender, right? Seeing a trend of a lot of females versus males deciding to seek therapy and seek counseling, and now we're starting to see a little bit of a rise in that, which is also good.
Great thing.
Yeah, and then also just the lack of resources or information, the education on mental health, in the community, and also looking at transportation, things like transportation. Sometimes we have a lot of clients that we deal with who don't necessarily have the transportation or the means to get to a therapist, right? And if they don't have that, do they actually have the funding and the financial piece to be able to continue? And some of that, of course, I think there's a lot of where you have whether it's small practices or other facilities that don't really have or accept clients who have Maryland Medicaid, right? And that's a big thing.
Right.
And so if they're not accepting, the Maryland Medicaid or, other options, how do someone who really have financial financial struggles or challenges able to, afford that? And so that kind of keeps them away from, saying, okay, I'll, go to therapy to help whatever this issue is. And then if they are accepting Maryland Medicaid, in which we see a lot of people in the urban communities who may have that type of insurance, it's at a distance. And so they have to go far, and then that's where the transportation issue come about. One of the other things I heard you mention, Shanice, was kind of looking at the experience. Sometimes we'll have an individual go into therapy, not really like the experience, and from that say, oh, it wasn't a great, I went to therapy, it didn't work. But it's important to find someone that you can connect with. And a lot of times in the African American communities, we look for related, things that we can relate to. And so if we don't find a therapist or so that we can relate to, it kind of takes away from the experience, and then therefore, it's over. And so really good talking points and getting that through. And I want to kind of move on. We have another question. And yes, go ahead, Pierre. You wanted to.
I also wanted to allude to what you're saying. If you want your kind of your therapist to look like you in a sense, because I was watching the show where you had this Samoan family who was having a lot of issues, but the guy was reluctant to go see a therapist because the therapist did not look like him or know his culture. So it was like, what's the point of me going to this therapist if they don't understand my culture? I don't really know them. They're not the same colors, same skin color as me. So they weren't able to understand me. And I think that's what was very important when I was at Bowie State, where Dr. William had this different perspective of African psychology workshop that he did every April, where it kind of brings you in to how Africans and how African Americans do think differently from the counterpart. So I kind of feel like that ideology I can understand, but also we have to try to work around that as well.
Okay. Yes. Yeah,
Yeah.
that's true. Definitely true. We see a lot of that, as clinicians working with
Mm-hmm.
clients, and sometimes you'll have them say, "Hey, even friends," and not to jump the subject, but
Yeah.
even I've spoken with a number of friends and family members who would say, "Well, I think I'll prefer a male, or I think I'll prefer a female, or I
Mm-hmm.
want someone who's African
Right.
American. I want someone who's going to resemble me." But sometimes we do, it allows for you to be a little bit more comfortable in the session and allow for you to probably do the work you need to do in therapy. However, you may limit yourself in terms of the experience and
Right.
what you can really
Right.
get out of therapy. And so
Mm-hmm.
it's really important, that you kind of come to therapy and be open. So if there's anything that I can, advise our viewers on, is to have an openness, open mindedness on therapy, what therapy is, and learning about mental health and education about mental health, and how you can have it work for you so that you can live a more, you know, quality of lifestyle. And so, just show up with, being open minded and allowing for yourself to, have the best services that you may need, the best mental health care. Just like any doctor you go to, you want to, go with the best.
Absolutely. I definitely agree with that because a lot of times, even though they may not have the same culture or beliefs as you,
Mm-hmm.
as therapists, we're obligated to go to trainings. And so there's tons of trainings that provide people with the competencies to understand what African
Right.
Americans are going through, what men are going through, women are going through, as far as sexuality. And so there's opportunities for us as clinicians to further develop our skills and knowledge of our clients. And so it's definitely important to keep an open mind when you're going into therapy and they're not the same race or gender as you.
Right.
Yeah.
And
I think. Oh, sorry, Pierre. Go ahead.
no, I mean, what I was going to say is, I was taking a class called Theory at Bowie State, and one of the things that was very profound that Dr. Palmer, who was at Bowie State, stated was very profound. I think one of my first day in class, he stated that while you're in this class and you're being trained to be like a doctor, but you're a mental doctor. So the
Oh, okay.
training that we went, it was very rigorous, and I kind of feel as though that some people may not understand it because they don't know too much about what we do and what kind of training that we receive. So it's also good to train people, say, hey, this is what kind of thing that I had to go through to be able to understand, to be able to help you. So I think that once people understand the kind of training that we had to go through, the kind of like mental test that we had to go
Mm-hmm.
through to be able to be in our
Yeah.
position, they'll take that and say, okay, these people have been trained just like a doctor, they train for a
Mm-hmm.
long period of time to be able to do
Mm-hmm.
all this surgery, and you have different kind of doctors. Same thing with us. You have different kind of like therapists. So we've
Mm-hmm.
been
Right.
trained very rigorously to do what we do, and we put a lot of hours in and a lot of training. So I think those things that people need to be educated about stuff like that as well.
Yeah, absolutely. Yeah.
To also kind of piggyback of what Shanice said is, I think when people do face discrimination by clinical professionals, that can kind of be a deterrence to seek further help or assistance because of maybe one or two experiences, and then they kind of
Yeah.
put a wall up or a guard up to saying, well, I tried it, right? And it
Mm-hmm.
was horrific. It was,
Yeah.
but then, like you're saying, Margo, trying another clinician might be the answer, as you said too, Shanice. So that open-mindedness that you were saying is so key and so huge to come in on with like a blank slate
Mm-hmm.
and to to be open to building a rapport with the
Yes.
clinician and seeing
Mm-hmm.
how that goes.
Yes.
So
Yes.
yeah.
Absolutely. That's one of the first things I say
Mm-hmm.
in the very first session is, you don't have to stay with me, especially when I'm in the
Mm-hmm.
facility and there are other clinicians around, or just to seek other clinicians outside. But it's very important to feel, just if I do an assessment and I become your therapist, through that assessment, we don't have to stay connected, or you come in and you decide, this doesn't work for me. If we don't
Mm-hmm.
connect and you don't feel that, then that's okay, and I want you to know that you're not hurting me by that. The best thing that you can do is seek for
Right.
the best help for yourself, and I want to help you get there. So it's important for me to let you know that this is really your trip and your journey, and so it's important that I get you and connect you to the next individual or clinician that can be able to help take you through that journey. Yeah.
Right.
Yeah. Some good questions, good answer. And so I guess we can go on to our next question for this evening.
Okay, so the next question is, what are the most common mental health illnesses in the Black community?
Um, I think it has to do with it goes back to slavery, it goes back to oppression, it goes back to discrimination, it goes back to it goes back to the time that we were enslaved. I say that, however, with caveat. I think that it's us being able to understand our history, us being able to understand the things that we had to endure by coming to a new world where we kind of had no understanding, no comprehension. It does set us back to tremendously. And I think that also we've been trained, in a sense, African American male, we've been trained to think that, well, since we were male, we should be able to handle everything. We shouldn't be weak, and being able to going to see a counselor is seen as though it's like you're a weak man. You're not able to handle mental challenges, and I think that's a facade in a sense that to think that, well, just because I'm a man, I can't go through emotional issues or I can't cry because I'm a man. So there's the I think our biggest issue is being able to understand slavery, but it's also being able to go to navigate through a system that we was not built for us. The question: how do we educate ourselves? How do we able to get around that system to become better men and better women? And I think that now we live in a time where we do have those opportunities to be able to get the education that we need about mental health, get the help that we need, and so that we can kind of like so we're able to move forward, but not to say that to ignore the past. It's always good to understand the past, but it's how do you move forward on this by and be able to achieve your God-given abilities. The reason why I say it is we say this a lot of times to our friends, in relationships. We say these things a lot. We say, "Oh my goodness, forget about the past, move forward." Okay, but then how come we're not teaching that about our history? We understand our history. We should embrace it. It is a horrendous thing that happened to African American in this country, not just here, but also back home as well in Africa as well, right? But how do we embrace that history? But how do we move forward? And I think that's what we need to be educated. How do we move forward, right? Because we can't really go back. We can't really go backward, So to me, it's being able to understand that through education, through understanding economists, through understanding mental, your cognitive abilities, through understanding social, financial literacy. All these things will help you move forward by become a better man and better woman in this society. So I think that to me, slavery has caused us a lot of mental setback, but I also think that we can also we should be able to move forward as well by also understanding, not forgetting about our past.
Right.
Absolutely. Yeah. Right. And to piggyback off what Pierre's saying, as far as knowing our history, as far as slavery and even modern day going through some systematic oppression in this country and other countries as well, where Black people are, Nigeria, Brazil, they're suppressed. And so it's so easy to have that sense of hopelessness and like not wanting to push forward and, your sadness. And those are easy signs of depression, anxiety. And those are the most common disorders amongst African Americans and people of minority descents. And so with anxiety and depression, it's so easy for people to not want to try to do anything, try to keep the same systems going, not try to run for office, not try to push through and level up in their jobs. They're not trying to better themselves, and kind of leads them to using bad coping skills like substance abuse.
Absolutely.
Which is another top disorder amongst African Americans and Black people.
Yeah.
It's definitely something that's prevalent in the African American community, urban
Eh,
communities, where you do see a lot of that. It's a lot of anxiety, a lot of depression, and a lot of that are some of those core factors that Pierre was mentioning, kind of coming from a history of, and so how do you say, unbeknownst to you, that this is actually something that's kind of coming down a line, a history that repeats itself and continues to repeat and doesn't give us that education, so we stay ill-informed, to educate ourselves enough to know. And so a lot of these things continue to repeat themselves and it become a downward spiral. And so we do see a lot of, again, like you said, Shanice, the anxiety and the depression, definitely with the depression, because there is, a number of factors where there are the resources we talked about before, where financial resources and challenges with the financial resources. There incarcerated families, where there are parents that are incarcerated. Those families are dealing with that. We have families that are not meshed well together in a household. And when you don't have a family that's not very well meshed, there's conflict and friction within that. And so that keeps, a lot of, the stresses and depression, going. And then there comes that anxiety from just the unknown, because there are a lot of life challenges. And then one of the things I want to kind of piggyback off of what you said, how it's like kind of a system of slavery, and kind of takes us to a lot of our what they call ACEs, adverse childhood experiences, where there's a number of things such as trauma, whether that's sexual trauma, physical trauma. Just being, in a community and in your environment and looking outside and seeing all the violence. And so a lot of that brings on a lot of the stresses of, having anxiety and having depression. And so that's why you see so much of that in what as clinicians, and I know we have this, we'll talk a little bit about this later, but, as a clinician, what would you say to that,
I think
anxiety and depression in the community?
I think one thing that I think there's a lack of cohesiveness. The reason why I say that is because we have people that who are blessed enough to say, who are able to become someone within the system, right? But the way they preach down to the others who are not in that level yet is like this kind of like a self-pity mentality, which some young people do gravitate to and use that as those like a scapegoat for a lot of other things that goes on in their life. Like I think like Shanice was saying, is that lack of accountability to some extent, to me, can also be very detrimental to the community. And I think that once for an example, right, when you hear about racism, we know that it exists. We know that there's a system that was not built for Black people. I understand that, but then you have people who have made it through education, through hard work, but they're telling people, well, this is still like a stigma. But how did you make it? Can you educate people on how you made it? How are you able to make it to where you are today? Because yes, the system is bad, but how did you do it? Can you teach me how to do it? You understand what I'm saying? So I think that we have to be able to look at those things and say, okay, I'm gonna help my brother and sister. I'm gonna be like the Jewish community, which I admire very much. They lift each other up. They've been through a lot, not to the extent that we've been through, but they've been through a lot. But they're able to lift each other up and kind of like uplift each other. But we don't do that as much. And I think that that's something that can also help us with our psyche, to see that our brothers and sisters making it, where they're also teaching us how to make it as well. I think that'd be something that would be very beneficial to the community if we start talking about, hey, you know what? We have some positive brothers like Hill Harper, Dr. Thomas Sowell. You have all these great scholars who've made it, and they're trying to teach us how they did it. But some of us don't really pay attention to it because they're not the rapper of the world, they're not the music star, they're not the sport athletes. I think those are the things that we really need to find the scholars who are trying to teach us about, like the economics and other different stuff.
Yeah.
I think I also want to piggyback. Those are great points up here. Just kind of like having each other's backs in a sense, right? Like I'm here. I'm trying to help you also get here. Well, we prayerfully will get to that point someday where people who do have influence and the right influence, I should say, the right influence. You can have bad influence too, but people who do have the right influence, either politically or educationally or whatever level it is, that people do actually gravitate towards them. And that what they do pour out into the community, people are receptive of, to know that, yes, I'm capable of doing this. I am capable of finishing high school or whatever, getting my associates or my bachelor's, and I could still do something with it. Right. So those are really great points. The other thing I was trying to say, which has to do with Margo, is how trauma plays a big role in our mental health. And especially, well, for both male and female, especially when you've witnessed deaths through either gun violence or police brutality or just through the whole criminal system. So it's tough, but you have to, when you're seeing clients, understand that their experiences make a great part of who they are.
Yes.
And we want people to understand that we do hear and see. We might not all have the same experiences, but we probably have encountered someone who's gone through something similar, if not worse. So it's so key to inform people that, yes, we understand that there are all these things against you. We're coming alongside you to help you get to wellness. Despite all the challenges, traumatic challenges you've been through, we want to help you to get here, to be the you that Pierre said, that person that God has created you to be. Because if you're not well, how are you able to go to school, to finish? If you have a mental health disorder, say, for instance, bipolar. I knew a guy in college. My undergrad was Morgan State University. Because of being bipolar, and he would take his meds and sometimes not take it, he dropped out, I want to say, sophomore year. Okay. So, and he was a Black male. So many things impact us, that we have to, as clinicians, we're being trained to, and we see it personally with other loved ones and friends and family, that we're understanding how impactful experiences can be when a person walks into your door and sits down to counsel with you. So it's challenging, but that's why we're doing what we're doing. Absolutely. So people are aware that, yes, we're understanding and we're non-judgmental, right?
Yes, absolutely.
We're not there to harm you.
Yeah.
We're not there to judge you at all. You've been through what you've been through, but you're here today, alive, sitting in a chair, and everything. Also, a lot of things, if it's not boils down to choices. If it's not something that's neurological, right, that you're not capable of making that choice neurologically, right, we have to choose against all odds, fight to choose to want to do better. If it's not neurological, if it is, and you can't make, that's a whole different discussion, right? Yes, but if you're able to, and you choose not to, that's a different thing. Yeah. Right. Entirely. So, but we are here to help. That's the goal. That's why we went through school, and it's tough, as you all can attest to. Yeah. So we can help serve you. So that's the message we want to send, that we're here to help, to serve. So embrace us.
Absolutely.
If you can.
And if I can say, we asked the question, what is mental health? And so, we answered some of that with, yes, it can be, the social and emotional and, psychological well-being, right, of us. And so what is therapy? What is mental health therapy? And what does that look like? Because a lot of people come in and they're not sure. I had a friend who actually just recently, a couple of weeks ago, called and asked, so how am I supposed to feel? Am I like, they wanted to know, like, what should I expect and how should I feel? And I mean, I can't tell you how to feel, because this is your journey. And so only you will know what you're going to feel when you're there. But I can tell you about my journey. Right. And so I had to kind of walk them through in the sense that, don't just rely on that thought, that one question of what am I supposed to, expect, or what am I supposed to feel? I spoke to him, but this is how it went. And then I felt like, and so there is no feeling. It's just what you're feeling at that moment. But one of the things that you need to do is be able to connect. You have to connect with that therapist. You have to connect in a sense, to where it allow for you to open up and do the work that you really don't want to do, the work the feeling that you really don't want to feel. And we don't know that we already are not feeling well, but we say no to therapy because no, it's going to make me feel wishy, or it's going to open up some wounds, but you're already kind of living through that. And so why not live through the ones that you're going to benefit from? And so you have to be able to try to connect, with the therapist in order for that work to happen. And you have to understand how you show up. And some of the work that I do with my clients is I work from the core. And that core is kind of like how Pierre said, you got to kind of know your history. And so we may not have the time to sit and do a lifespan of work, to help you understand where you are today. But however, we can tap into some of that while we're fixing some of what we need to fix today. But it's important for you to understand what that core is. Because if you don't know what that core is, you will not realize and be aware of how you're showing up in the world. And the main thing is you have to understand that tomorrow when I wake up in the morning and I'm feeling a certain way, I need to understand where that's coming from, where that stems from, and what my view is that keeps me in that. And what can I do, to help bring me back to, just for me to get through my day, get to work, get through my work to where it's not interrupting, my life and my livelihood. And so, it's very important to understand that core, and that's one of the things that I definitely operate from. So I agree with everything you all are saying.
Yeah, that's definitely important. Go ahead, Pierre.
No, I mean, what I was gonna just piggyback on what she was saying. Like, even if you wake up in the morning, like you were saying, you don't feel well. That's why you have mental health days for work. Like I have mental days where if you're not feeling well, you don't need to go to work. You probably have to process something, or you have to talk to somebody about something, or you're just not feeling well. It's okay. And I think that a lot of time that we take that as being like such a negative connotation. Mental health doesn't mean like you're crazy or something is wrong with you. A lot of times people think that's the thing, or they think I'm crazy because that's why they want to go to counseling. No, that's not the case. And I'm just reading a study, for example, that says that about 63% of African Americans believe that mental health condition is a personal or sign of weakness. 63%. So that's a pretty large number. And to me, we have to be able to get that 62%. Say, no. Mental health has it's different variables, it's different things. It doesn't mean like just if you get to an argument with your wife, you don't feel well the next day. Well, that could be a mental health. You might need to go talk to somebody. Hey, me and my wife had this kind of argument. Can we talk about it? Because if you don't, what's going to happen is frustration is going to keep building up, and then you're going to explode. So that's why it's very important for us to be able. That's why we're able to help you with your cognitive thinking. Right. And the biggest battle we fight is not physical fight; it's mental fight. And that's a lot of things people don't understand. Is mental is the biggest battle you fight every single day.
Yeah, and a lot of those fights are unresolved. That's why,
right?
And that's exactly why we stay in that mindset of needing that help. Yeah.
Because it starts in the mind, right? It starts in the mind, that negative thought, right?
We start feeding it, and then it becomes this big ball of whatever that we just made up in our heads.
Right.
Yeah. So like Pierre was saying, I definitely think it's important to not just look at your physical health, but also your mental health. Yeah. So taking those days off when you don't feel well, because you may not have a cough or, sneeze or, flu or something, but taking that day when you're just not feeling your best. Because, you don't have to have severe depression in order to, want to take time for yourself. You don't want it to get to that point. You want to be able to recognize the signs. Today I'm not really feeling well. The past week I haven't been feeling well. Well, maybe I should go talk to somebody. Because therapy isn't just for when you're all having those bad days. It's also to prepare you for when you do have those bad days. You know how to cope with it and how to deal with it.
Absolutely.
Yeah.
Absolutely. That's exactly.
Yeah.
That's
so
exactly
that's self-care, right? The self-care piece of just, taking care of yourself. So you are your best is so significant, regardless of what you do and how you do it. It's so key, because then you step out into the world and you're able to do what you need to do, because you have a balance here, right? Yes. And then not being balanced here affects everything else. Yes. Right. And so it's so important to help people understand, make that correlation, right, between its mind, body, soul, all of it, all of it combined makes you that whole you, healthy you. So, self-care. I agree.
Absolutely. So that's great. And actually, we have a couple of questions that are coming through.
Okay.
And so if we want to jump into those really quick, and then we can head on to our next questions, but it kind of relates to some of this. And so let's see. So how can I speak? Well, this is a question coming from one of our viewers, and it is, how can I speak to or help someone with a mental health problem?
Listen and try. I think listen is one of the best things that you could do for any human being, by listening to them while they're going through something. And if they're willing to get help, then you're able to help them, then you should kind of direct them to the appropriate place of help. Like if they're having like mental breakdown, well, I'm not sure if you're in school, if you're at work. If you're at Bowie, I know Bowie has a program where you can go to counselors, where you can go talk about your different issues with counselors. I think it's in the MLK building upstairs, where you can go to talk to those counselors about different issues that you're having. So the universities or high school, they all have programs for whenever you're having like some kind of meltdown, that you can always have someone to talk to. So I would say talk to someone and listen and provide information that can help that individual.
Absolutely. Definitely agree with that. Definitely listen and just validate their experience, because what they're going through. And if their issue is to extreme to a point you feel like they need additional support, definitely refer them to a school counselor if they're within K through 12, college counselor if they're within college. There's plenty of resources online to finding a therapist. If they have a therapist, ask them if they're going to their therapist. If they're dealing with substance abuse issues, or maybe more like schizophrenia, bipolar, you can always recommend the crisis center to them. There's tons within each state that can help people kind of find balance in their medications, or just kind of stabilize them to transition to somewhere else. And so there's definitely tons of options as far as like researching them, see what best suits that person. But just number one, definitely listening to them.
Yeah. I would say that if the issue is more escalated beyond all that Pierre and Shanice have said, then you definitely have to call 911, and so that person can get immediate service. They're able to take them in and help them immediately. If it's something that cannot wait to be scheduled, to see someone face to face to have a session with, then do go ahead and dial 911.
Right. And if you do have a concern about calling the police in your area, just because of the certain thing going on, there are crisis hotlines you can call where a mental health professional and EMTs can come and assist. So 911 isn't always an option sometimes. Some people may not feel safe. So that's also an option.
So grassroots, for example, right?
Yeah. So grassroots in Maryland is a great option.
Grassroots in Maryland is a great option. Yeah. If you can't do 911 and get involved that way, grassroots is terrific at helping that way.
Okay. All great. And one last thing I would say to add to that, because all of your answers were great, but environment and really setting the environment for that individual really depends on where this happens. And so if you're at at work and you're dealing with students, you want to make sure that you create an environment that is welcoming to that student so they feel safe. That's always important for the schools, is creating a safe environment, and it allows for them to feel as if they can be able to disclose. And college level, same thing. Or if this is a friend or a loved one, You want to, maybe, create an environment that's welcoming to them, to have a nice, sensitive, conversation, because we're dealing with a sensitive topic. And so you want to make them feel comfortable, make them feel that it's okay, in terms of if the discussion comes to talking about mental health and therapy and having, seek help or whatever, have you. And so you want to be able to create a warm, welcoming environment, and then also being genuine, within yourself. And so that can allow for them to kind of open up a little more and be more open to the option of going to seek mental health care.
Empathy.
Yeah.
Empathy. Yes. Yes,
yeah,
absolutely.
And actually that question came from one of our viewers, Giselle, and she is in New York City. And so, your local, providers, and crisis hotlines, right? And then one other question, and this is also coming from New York City, also from Giselle. So as a specialist in higher education, and higher education setting, so we're dealing with a college level, I find that students are not keeping their appointments. How are patients being engaged? For me, if I can just go first quick, that is sometimes a trend. You may have, your frequent clients who frequently cancel or may not show. And one of the things for me is I like to try to set a policy or boundary around it that state, it's important for you to keep your appointments, and these are the reasons why. A part of therapy and a part of your experience can be helping you to become a little bit more aware of your time management, and the importance of this relationship, so that, your therapy can work. And softly, not being so stern and so hard, in terms of trying to set your policies around, your counseling services, but allowing for them, to be held accountable, for, their therapy, for their change. But I think what's also important is trying to keep them engaged. And so if you have a client that's not so engaged, and then they have a lot of no-shows, a high record of no-shows, you want to see if there's anything that you can do within, your scope that will allow for you to be more engaged with your clients, whether that's being a little bit more, I like to say hands-on, but not hands-on physically, but doing a lot of homework and things with them, doing a lot of, I want to say work with them that will allow for them to be a lot more active in the therapy session, so that they can feel, a part of, and then they can really start to feel, I guess, a little bit more of that engagement to say, I think I might come back, because that was, I didn't want to do it at first, but, it felt good afterwards. And so when you kind of keep them engaged in activities of therapy, that allows for, them to kind of think about maybe correcting their attendance behavior in therapy.
Right. Yeah,
go ahead, Shanice.
And I was just going to say, as far as keeping them engaged, just asking the client at the end of each session, or every now and then, their feedback as far as how it's going for them. If they like the techniques you use, the materials you use, activities, games. If we're dealing with children, it's best to see if they like it. If they don't like it, kind of see what they do actually like. So you're kind of keeping their interest. And if it's something they suggest that you're not knowledgeable on, just let them know you can refer them to someone else. So if you do feel comfortable and actually do want to come often.
Yes.
I was going to say that also knowing the personality type of your client also is helpful, because then phlegmatics are this way, people are artistic, a bit laid back, and what drives their energy or kind of decreases it, right? So then you're able to engage. So as you're saying, that even the activities or the homework assignments that you give them, if that person is a logical thinker, what kind of, assignment to give them that will get their wheels turning and excitement, and be like, oh, I can't wait to go back and talk to this, to my therapist about this particular work that I just did. And so I think personality is so key, because it also impacts how we do things and why we even want to do it. Right. Do we even have the energy to want to do it if you're, the personality type that you are? So I think that's important to factor in as you want to engage with your clients.
Yeah. So that's great. And so I guess we can move on to our next question.
Okay.
Okay. So, um, what role does culture and spirituality play in mental health? And why is it important to consider mental health care like therapy? I don't know. Do you want to answer that, Pierre?
I'm sure. I think as you know, I'm Haitian, and growing up in Haiti, it was like a taboo, like most African American in this country as well, like to go to see therapy. And I didn't even know what a school counseling was when I was a kid. So when I came here, it was a very shocking. It was shocking to me that, oh, you got a school counselor, you got a teacher, you got all these resources that at your hands. And that when I did go through stuff in school, that I had somebody to talk to. And one of the reasons why I really wanted to be a school counselor is because my high school counselor and I were very close. So I kind of felt like I was going to help someone who was in the same need that I was at that time. And now I'm able to do that being a school counselor and also have the background of, hey, I'm dealing with a lot of Hispanic who also kind of went through the same thing that I went through, where it's like a culture shock to them to say, well, you have a school counselor. So, and I have students that have said, they know what, Mr. Dove, I like to be a school counselor one day because of the way that you treat me, because of the way you're with me. So I think culture has something to do with it. Being able to be accepting to counseling, being able to say, what, that's part of life. And growing up in Haiti as well, they teach you how to deal with stuff like to be mentally strong. And that is, and if you're not strong, then you're weak. So now I had to obviously reverse my thinking process and understand that psychological help is also very important to your health. Spirituality, well, that's how most African Americans deal with their mental issues or challenges, because they believe that um, God is there to help them, and their faith will help them get through it, which is absolutely, to a certain point, that is true. But also, God also provide with people to also help you as well. So God provide things for you so that you can get the help that you need. A lot of times people think that, well, because I go to church and I don't need counseling. No, actually, God put you here for a purpose, and He put a counselor here for a purpose. Like He put here for a doctor who do all these different surgery here for a purpose. So I think to me that's a very important thing. And another thing I really wanted to add is, I don't know if you guys ever heard of this story about the old Cherokee, where that there's in each and every single one of us, we all have like two wolves inside of us. Two wolves. One is a good wolf, the other one is a bad wolf, right? Whichever wolf that we decide to feed is the wolf that's going to define our character. It's going to define a lot of different things in our lives. So if we feed the wolf with positivity, being able to go to counseling and doing all the things that we need to do, well, our life will possibly be more positive. But if we bury certain thoughts, if we oppress certain thoughts, if we feed negativity, then that bad wolf will win. So I think we have to be extremely careful of our psychological health, because I always tell my students till today, your mind is one of the most powerful things that you have. Everything all your actions start in here. So your mental strength is absolutely is paramount. And I think that's something that I really want to teach my kids. And that's what I'm doing right now as a school counselor. I literally have like all these different lessons, talks about different characteristics and how you're supposed to be able to build your mind, your character strongly through psychological training. And I think that every single day we wake up, we have the opportunity to train our mind to be strong every single day by also talking to people, but also be accepting a certain not advice, but a certain what's the word I'm trying to find? Certain help. And mental health is also very important for the benefits of our whole holistic care.
Right.
Yeah. I think for Black people, the church has been very pivotal in its spiritual concerns. You have the clergyman. If you have an issue, go to your pastor and talk with them, or if it's a woman, you go to your first lady or what have you, or just even a ministry leader that has been so impactful, because they've handled a whole lot of different things, from personal problems to interpersonal. It could be a whole family having issues, and then they go in for counseling through the pastor, right? So we have to understand that that has been the go-to for the most part, but also as a believer, just like Pierre said, God is the source, right, who has given us these resources to have, right, around us. So people are like God's hands and feet, right? So from the doctor to the nurse to the pharmacist to the lawyer and engineer, we need all of these people in society to live and function. So just as much as you would go to a pastor, and then they might also be limited in some of the things that they can help you with in terms of actual severe disorders, right? Because they don't have that training in psychology. Some do, don't get me wrong. Some do. Some have both degrees. So that's fine. But and as much as you do seek the pastoral, you should also seek the professional help as well. Absolutely. So, and if you're able to find a Christian counselor, if that's what you go for, that's also fine, because then they're also trained to walk with you from the biblical perspective, right? As well as help you with your psychological concerns. So it's important to know that we're not disregarding anything. You can walk alongside and still get to your wellness. You don't have to throw out God and say, oh, if I go here, then I'm going to be on meds and I can't read, my word. And no, if that's what you want to do and you opt for a counselor that's not a believer, that's fine. If you do offer one that is a Christian counselor, you can bring your faith into the counseling room. So it's all choices, what you're looking for. At the end of the day, what your goals are as a client, a person seeking help, what you're looking for, and then that's what you go in for. So I hope that people understand that it's not to put God down or to put, a person's faith or a person's ministry, not at all. But at times you have to get more than just that. Yeah. You need a little bit more.
And we have to remember that in the physical, we still have to do the work. We still have to do our part. So we can bring in our, our spiritual beliefs and our religion, but the physical, we still have to, and I always say sometimes, when I ask people, well, I'll just pray on it, or I prayed for it and it didn't happen, but what are you praying for? Because one of the things we always need is the strength. And so praying on the strength to be able to give you the tools and things that you need to continue on and do what you need to do. And so definitely.
Absolutely. Yeah. And then definitely for one, just being able to be honest, open with your therapist, letting them know that your beliefs in God or whoever you believe in, your spirituality is important to you and something that you want to integrate into the therapy. And so that they can factor that into as far as, your goals, or if they can, refer you to someone else, because there's tons of programs being created now for pastoral counseling that are throughout the country. They're becoming more and more popular. So there's definitely options. So just it's very important to be honest with your therapist about your belief systems and your culture.
Yeah. Yeah. And today, you have a lot of therapists, they'll have it listed, that's one of their, modalities and their practices that, if that's what type of counselor you want, or therapist you want, a psychologist you want, they usually have it listed, within their title and description of their niche, that they do, if you're looking for spiritual counseling, if you would like to have that added into your session. And so you have those options today versus, before, where you may have been challenged to really find a counselor or therapist that can be able to provide spiritual leadership within that session.
And then most intake forms list that on there. Do you want to incorporate your faith or your beliefs or, spirituality into your sessions or not? So you can always opt in or opt out.
Yeah, absolutely. And so it seems like we have another question.
Okay.
Okay. And because we're coming upon our last question, which is more so a wrap up. And so let's go ahead and get this one in. One of the things that we mentioned a little earlier as it related to some of the barriers and as it exists with mental health. And so we have Ivy, which is from someone coming in from Maryland, actually. And so the question is, you mentioned financial strain of getting treatment or therapy. Do most government-assisted programs offer mental health services for free, or is there services through private insurances? And I think is that kind of part of either, if it's not our last question, it's kind of like our wrap up and providing that information, right? Anyone want to take that on in particular, or we can wait till the end? But there are services that are now in which it was a challenge, and it is difficult because you do see more of private insurance holders being able to have access to mental health services. And that was one of the barriers and challenges that we faced in African American communities. And it seems to be growing more now where more government programs are offering it. And especially in today's time when we're dealing with this, global pandemic, where it allowed for a lot of, this to happen. And hopefully once we're past this and we're more in a more healthier world of living, that it will continue these services in these communities that are more accessible. And so one of them, we do have a pro bono website where it's pro bono counseling that offers free counseling for individuals who may come from low income areas and who may be more of an individual who will not really go to counseling because of some of those barriers. And so we'll provide that information at the end of this session or at the end of our discussion. And I also, I guess as we move forward with others, discussions kind of provide more information as it relates to that. But across Maryland, yes, there are growing opportunities for individuals to seek mental health because mental health is now definitely something that a lot of people are experiencing, and especially within, again, this global pandemic. And so, do we want to go on to? Oh, we have one more question.
Okay.
Yes, and that other question is the process of grieving considered a mental health issue?
Absolutely.
Yes.
Absolutely.
It is. Yes. The process of grieving is definitely something that becomes a mental health concern as it relates to. It's not easy with how we have when you hear people say, well, it's been a long time now, and you should, feel a little better about it, or, get over this, depending on what the situation is. I kind of practice the stages of grief, even, not within a session where someone is grieving through death. Because a lot of things that we go through is an experience such as death, like divorce, can be considered, grief counseling, and kind of working with clients to be aware of those stages of grief. And when in those stages of grief, being aware enough to be able to use the coping skills needed to help you outside of the counseling session. There is a lot of anxiety and a lot of depression that comes with death. And I want to say almost immediately you experience a lot of anxiety, a lot of excessive worry and fear, and of the unknown. And so it can become very stressful for you as well as your family members. And then there comes that depression, and so much of the shoulda, coulda, wouldas. If I was there, I wish, if I could have changed things, if I could have said this. And so a lot of depression becomes around that, and then the loss of the relationship. And so it's really working towards trying not to cross the boundary where you kind of stay more so in the grief longer, but it's really just learning coping skills to manage that loss and learn to live. A lot of new relationships are built through death. A lot of new experiences in life and decisions made in life are surrounded around death and come through that. And so it's really working with a therapist to understand where you are in terms of the loss of a loved one, and you and your thoughts and feelings, and then where can you go from there. And so working with a therapist is definitely recommended if you do lose someone, a loved one. It's very important that you do meet with someone to have those discussions that are buried in your mind, that don't go away. They continue to pop up because you can always try to get rid of them, but if you don't process them, with a professional, they'll always resurface. It's kind of like a pot that boils. You put the top on and it's going to continue to boil over until you have that breakdown, right? And so it's best to kind of address it and face it, and kind of come out on the other side of it and have a better understanding of where you are in life with it. A little bit more accepting, but again, it's never something to get over. It's just learning how to cope in that new life.
Right, because there's no one set way of grieving.
No.
Right.
Just because you're not crying all the time doesn't mean you're not grieving.
Right.
You just show it differently. So definitely, if you do feel like you need that additional support, besides talking to your family members, seeing a professional counselor to help you kind of go through those motions to understand what you're feeling. If you're kind of suppressing those feelings, you don't want them to build up.
Yeah. Well, yes.
Absolutely, and I think that like Shanice was saying, that everybody grieves differently. I mean, a lot of people that cry, they do. Some people, they just very quiet and take everything in, and they don't really express it. And then later on in life, something could happen to them. Be like, whoa, what happened to this person? Well, because nobody paid attention to that person, because they thought that this person was like strong and they didn't cry, they didn't do this. And boom, they didn't know that person was taking everything in, didn't know how to express their thoughts. And later on, they just like kind of just explode. So I think that it's important to pay attention, not just to the people who are crying, but also the people who are not really doing anything. Also pay attention to those people as well. Because if we don't pay attention to them and we only pay attention to people who are only crying, then that could be an issue for those who are like less quieter. So we would have to take like in consideration our family members, our friends, whenever they go through something, watch their body language and watch how they kind of like take negative news, and do they verbalize it or they just keep quiet.
Right. So be mindful of the person in the family who's considered the rock of the family. So the grandmother, the grandfather, maybe the parent. That's the person that everyone goes to when they're feeling something, but no one checks on them sometimes. And so definitely noticing the signs to make sure that they're okay too.
Absolutely.
I think what I can add is, as you both said, paying attention to the cues and being empathetic, allowing them to grieve, giving them space and not saying, oh, be quiet, or oh, don't shed that, like, here's a tissue, like wipe your eyes and go about your business. Allowing people to, and then paying attention to when it's like their functionality is crippled. They don't want to get out the bed. They don't want to eat food past a certain amount of time. You see it becoming a pattern where it's going on for months on ends, or it's a year and a half. It's going on for a duration of time, and they're just dwindling down. They're not the person that you know them to be. So you have to then step up and say, I care about you. This is coming from, my heart. My intentions are pure for you, but I think you should seek help, professional help, because grief can be devastating for some people. It can really impact them to where their whole life course is altered and they just don't want to do anything else without that person that they just lost. Yeah. And as you said, Margo, divorce can also do that. It's not always a physical death, but it's also the death of a relationship. So people should also bear that in mind when people are going through the divorce, because you can't see, there's not a physical body there that you went to, paid respects to. It is to a relationship, something that you had for however long it was for, right? it was someone you care for, maybe had kids with, just envision a future with, and then all of a sudden that's gone. Mm-hmm. So now you have to restructure your whole life, your whole plan, or way of living, right? Mm-hmm. So that's impactful, and that is also grief. So to bear that in mind, also look for the signs when the person is not functioning. They don't get up to go to work. They're calling out all the time. They're shut in. They don't come outside anymore. They don't attend whatever normal stuff they used to past a certain period of time. So just being mindful to read the signs and be able to not be fearful, but to step out and seek help for your loved ones.
Yeah.
And may I add this, Margo, real quick? This is very, very important. Mm-hmm. Also pay attention to social media, what they're posting and how they're posting it. Mm-hmm. Recently, there was a tragedy that happened in the Haitian community where this young man was crying out for help in his social media. Nobody took him very seriously, and he ended up killing himself. Mm-hmm. I have a coworker, and even though I don't really have his phone number, but there's something that I see because he suffered from bipolar, according to him. I see him posting about different weird stuff. So what I do is I will text staff who have his phone number and say, hey, can you please check on this person because they're posting stuff that kind of like concerning me. So pay attention to what the people are posting on social media after a certain tragedy, even if it's not a tragedy, even if it's something that you want to certain people, you're like, whoa, what's going on? Even if you don't even know the person, you can also check into as well. Say, hey, I saw that you post this. Is everything okay? Do you need help with something? So I think that it's very important for us to pay attention for those around us, but also those who are also on the social media who are posting stuff that can also be very detrimental.
Yeah. And just the last part of that is when dealing with grief, one of the great things in counseling is learning and being aware of those stages of grief. And it's not that you go through each stage, like as stage 1, I'm in, stage 2, then 3, you may bounce all around in those stages. But being aware of what the education on what those stages are so that you know where you're coming from, for that day, right? Because we have in the stages of grief where it's the denial and, sort of shock of the loss of this individual. And so you're kind of in denial and, you don't believe it. And, you're still kind of, maybe sitting around waiting for that person, they're going to call, they're going to come. I'm not, accepting it, and you have a really, really hard time coming out of that. But then, there are other stages where you kind of go through your, feelings of guilt. If you're feeling like, okay, if I could have been there, I would have changed it. If I would have just done this one thing, that would have happened, and, the bargaining of if I can, if you do X, Y, and Z, prayers to God and, bring this person back, and then I promise I'll do, X, Y, and Z, whatever it may be. And so all of those different, stages you kind of go through, and then going through the depression, and then going through, a more upward feeling of, okay, I can bear this, I can do this, I can cope, and then there are times where you're working through where you start to reconstruct, and then you're building relationships. A lot of I always tell clients you will start to have a lot of new relationships and just different things that you do in life because you learn to try to cope, and you might meet new people and meet others who may have lost a parent or lost a husband or lost a child or any loved one. And so you have all these different things and these resources that may help you to just function and keep going. And so you begin to live life differently through that death, and you got to work through learning how to accept so that you can then just cope better. That's about it. It's just coping better. Yeah. And so our last question of the evening is really more so, I think we kind of answered some of it anyway, but that last question, what do we have?
What expertise can we offer our viewers in hope of using therapy to manage mental health problems? Shanice?
I would definitely just say, make sure you're going to the right person for you. I know for me personally, I like to use a lot of CBT which is cognitive behavioral therapy. A lot of client-centered. I also like to look at a lot of people's childhood experiences, because a lot of people don't realize your childhood experiences affect you as an adult presently. And so those kind of things I like to use. And I'm a very big advocate on, physical health to kind of help you with your mental health. So a lot of yoga, breathing exercises, mindfulness. Yeah. And for me, I like to specialize with, trauma, anxiety, and depression. So kind of just knowing the therapist that you're going to kind of fits your needs. Because, I obviously, if someone who's looking for couple therapy, not that I wouldn't mind helping them, but sometimes I'd rather just refer them to someone else who, like Edna, who I specialize in couples.
Yeah.
Thanks, Denise. So from a couple's perspective, mental health is so key because it can impact your finances, it can impact your intimacy, it can impact your parenting, your career, ministry work, and so forth and so on. So being able to come in for help, it's not a sign of weakness. It's a sign that you're committed to your relationship and you really want things to work out, and for the longevity of it, if at all possible. Because there are times when couples come in, sometimes it's in dire straits, sometimes it's at the last possible end where someone has made up their mind already. But if you see signs of things, be it addiction or trauma or something that's an event that has triggered a certain emotion in you that you're not used to, you should come in and get help for it as a couple, so you both can function and live the kind of life that you want to live out. And as Shanice said, CBT is a great thing because a lot of things do start in the mind. And so you thinking, oh, my spouse doesn't love me anymore. But then it's one incident that happened that you have that thought that, oh, they don't love you anymore. But in actuality, it might be a whole different set of issues that's causing this thought. So being able to come and sit with someone who's objective and it's not on any single person's side, we're neutral, to listen and be objective and help you unpack the different issues. And sometimes you do have to go back to your childhood. Sometimes it's immediate where it's more solution focused. Or sometimes you have to delve deep. So it's important. If it's important, your relationship is important to you, you can seek help and be able to go through the things, especially now during the pandemic, where maybe some couples are not always used to being around each other. They're now in each other's face 24/7, so it's different. You can't go to work outside of the home for some folks. You just, park yourself in front of your desk. So just the dynamics might change, so communication is key, so key, being able to effectively communicate with their loved one. So nothing is too big or too small for counseling, I feel like. So you can bring all those issues in and we can help you get better.
Yeah. And would you say, Etna, because one of the things, and for me with couples counseling, when I'm working with them, is the love languages that always come across in counseling. Because it's a lot of miscommunication is actually within that love language.
A lot.
It's really understanding.
And personality too, right? Oh my goodness. One person is so laid back, and the other person is more choleric and just, I'm gone, I want this done. And you're like dragging your feet, in a sense. So it's, there's so many components, personality, as you're saying, love languages, just so many different factors. And even a person's experiences growing up, what they saw their mom or dad do in relationships.
And that's it kind of, that's an example of that, as you're saying it, is where you may come from a household where you got a lot of hugs and loves, and mom and dad may have always said, I love you, I love you, I love you.
Right.
And then your mate may not have come from that, and probably
not at all. Right.
And so they're not so open to, the love you all the time, or, accepting that. And so you might take it as, okay, so what is this person's issue, or, concern about it. And in your mind, you start to build that, okay, start feeding yourself that negative thought.
Negative, right?
And then it becomes an argument in the relationship because you're thinking this negative thing, where the reality is this person just don't know how to offer that because they never had it. And when you try to offer it, they don't really want it. They push it away because of whatever feelings they may have, and it comes from their childhood experiences.
Right, and then they show their love a different way by
a whole different set, right?
They may shower you with gifts. They may cook for you. They may clean for you. And so you have to understand their love language versus yours. Because a lot of times it becomes miscommunication.
Yeah, a lot. And then their transitions also, right? For some people, it's, we're now, middle age. We're trying to figure out what our next 10 towards retirement is. For some folks, they're empty nesters. Yes. So, it's now with me and the husband or me and the wife. So,
deal with
there's, exactly. And then for people who are in the early newlywed stage, it's just the two of them. So there's so many different transitions where people have to come in and get help, with, and there's nothing wrong with it. Absolutely nothing wrong with it. So,
yeah.
And I think a lot of things start with self. I think what most of you guys have said is absolutely correct. Because if you don't understand yourself, then you can't understand somebody else. And I'm a big fan again of CBT because it talks about fighting certain thoughts, disoriented thoughts. And a lot of times we can be our worst enemies. And I think that being able to understand who you are by getting along with yourself. And I think those things start with being honest with yourself. And if you're honest with yourself, then you can understand yourself. Then you can be able to express that to people that who you, the loved ones, your friends, whoever it may be. And I'm also a big fan of Albert Ellis because I think a lot of times we do this should. I should have done this. I could have done this. This masturbation mentality. Something can be our worst enemy. So it's imperative that for us to understand ourselves and be honest with ourselves and communicate our feeling. Because when we were to communicate our feeling, then we have a sense of release. We'll release whatever that was within us, and then we kind of say, hey, you know what? I need help. And the person came able to chase it. Okay, and this person, this is what they're going through. So how can I help that person? So again, being able to be honest with your feelings, with your thoughts, and also be able to fight. What's the technique I'm trying to think about when you're fighting your thinking process, the negative thoughts?
What, fighting negative thoughts?
Yeah, there's a name for it, but it's not coming to me right now. But it's just be able to, fight those thoughts, negative thoughts, and replace them with positive thoughts. So that's very important. So my advice is get along with yourself, be honest with yourself, communicate your feelings, and get help if need be.
Yes, and I agree. I always encourage in a lot of conversations I have with individuals. It can be a coworker, and we're talking. I say, therapy," and I always supporter of therapy. And I think it's important that we work towards understanding ourselves, just like Ms. Pierre and all of you all said. It's important to understand you. And when you understand you, you can understand how you show up in the world. That's one of the things I always say and use is that, you have to understand your core. And so I do work from a CBT, approach, which is cognitive behavior therapy approach, often using some solution focus as well, which is more of that, fixing the problem now. However, I think it's important that you do work on the inside out, but kind of using that solution focus to help with the outside in, right? Kind of using that to work with that here and now. But Cognitive behavior therapy is really good for individuals because, again, it helps you to kind of work through all of those thoughts that you have and that you fight yourself with, right? And so we always have a perception about what something is. If four of us in a room, all of us can look at a picture and have our own idea of what's going on in that picture, right?
Right.
And so a lot of times that happens just in life with a lot of things that we deal with. And then it becomes stress to us because we start to feed it. And give it this energy that it really doesn't, warrant when we can kind of work through it. And that's why I think it's important that you start from the core. And that core can be childhood. And so do we understand where that thinking came from? Why is that thought process there, and why is that your automatic thought? And so let's look back to some of what may have happened. When is the first time you ever felt that? First time you ever felt neglect. And so now that neglect is showing up in your relationship today. That neglect is showing up at work. You're starting to feel like everyone treat you a certain way. And so you got to know when you're showing up as that 4-year-old, or I want to say that 8-year-old, and that 12-year-old, and trying to deal with a situation of today. And so when you understand that, you can then kind of work through that process and say, you know what, maybe it's me today, and kind of do your check yourself. And if it's me today, then I need to fix my, if I'm walking into work, I already know how I feel and what's, what I'm processing. And so maybe, it's not, John, or, it's not this person. Maybe it's me. And so it's important that you kind of find, a good therapist that can help you work through some of the things that you might have in your life that's stressing you. Again, it's important to, if you have to search, for a good therapist, go ahead and do that. Search, look all over, do whatever you need to do till you find that individual that you're able to connect with, and that you're going to be able to express yourself and get out all of the things that you want to disclose, that deep, dark secret, that thing that you never told, mom or dad about, or your best friend about. That's that one thing only you know. Those negative thoughts you have about yourself, the hate you may have for yourself, that you never told anyone about. And so you have to feel very connected with the individual in order for that to happen. And don't be closed-minded into what therapy is supposed to look like, or don't be closed-minded to who can give therapy. Just allow for yourself to, if you have questions about what type of therapist you would prefer in terms of approach, that's something different versus, you saying, I need my therapist to be X, Y, and Z. You would limit yourself on the expertise of that individual, or what you can possibly get from another individual. And so therapy is always something that I recommend, and I recommend to my viewers that if there's an issue that you're dealing with, big or small, just working through some of life stresses, you can also, you can check with your healthcare provider, your primary care provider, to see if they can recommend or refer you somewhere. You can use your insurance and see if they have referrals, and then you can search on your own. But that would be, my advice to you all, is to definitely seek help. There's nothing wrong with seeking help. Therapy is good.
Don't be afraid to face the man or the woman in the mirror.
Absolutely. Yeah. And so how can we all be reached, if we can kind of go around? So for me, again, my name is Margo Claybrooks, and I am a mental health provider here out in Maryland. I can be reached on my website. My website is touchofpeacecounselingservices.com. All one word, touchofpeacecounselingservices.com. And you can find me on all my social medias, which is linked to my website. Again, Touch of Peace Counseling Services. And my name is Margo Claybrooks.
I'm Pierre Bachelor Dorval. I'm on Facebook. It's Pierre B. Dorival. I'm on Instagram. It's Bachelor18. My email is Pierre dot Dorival@yahoo.com.
And my name is Shanice Martin. I can be reached via email, either from smartin@abcmaryland.com or by ShaniceKMartin@gmail.com.
Yes.
What happened to Edna?
And I think we lost Edna.
Yeah.
Yes. And so I'll gather Edna's information, and we can have it available once the video is posted. And then we will see you all again on our next mental health discussion.
Thank
Yes.
thank